I thank Dr. Juan Pablo Lievano for dubbing this video in English. In a moment, we are going to perform the intradermal continuous suture, the knotting of the suture, and its particular stitch removal. To begin the practice, make an incision on the porcine skin down to the subcutaneous fat. Insert the needle about 5 mm apart from one of the borders of the incision and continue advancing the needle through the dermis in order to come out superficial in the dermo-epidermal junction. Retrieve the needle with the needle holder. In the other side of the wound, observe the place where the needle exits the tissue and calculate a few millimeters behind the spot to do the second bite. Insert the needle and advance through the same layer and again come out superficial in the dermo-epidermal junction. Observe the place where the suture came out in the opposite border of the wound and calculate to insert the needle a few millimeters behind this spot. Continue entering through the dermis to perform the closure of the whole wound with a continuous suture in the dermis layer. The distance of each bite depends on the skin's thickness and the suture gauge. In the case of an eyelid, this distance can be of 1 or 2 millimeters. In a thick skin, like in the back, it can be about 1 to 2 centimeters. In this practice, I'm doing them approximately 5 millimeters, using 4/0 polypropylene suture. Continue the suture in the dermis layer on both sides of the wound. Be careful not to cross the suture with the previous bites, or it will get knotted internally and the suture won't run. To do the last bite, insert the needle through the dermis and come out through the epidermis, about 5 millimeters apart from the wound's end. Pull the suture and make sure it advances with no limitation. Flatten the tissue and proceed to knot the suture. There are different ways to perform the knotting of the suture. The first technique we will see is the knotting between the edges of the suture. Make 2 loops around the needle holder with the long end of the suture. Take the other end with the needle holder and lower the knot. Request a helper to attach a clamp to hold the knot. Continue knotting the suture until completing 5 knots. The second technique consists in making independent loops at the end of the suture. Begin with the end of the suture that is attached to the needle. Make 2 loops and grab the suture. Lower the knot to the tissue and tighten it. Continue doing loops until completing 5 knots. When you're done knotting, cut the suture. Do the same procedure at the other end of the suture. If the suture is short, grab its end with a mosquito clamp. That way, it will help you do the knotting. Make 5 knots and cut the suture. To remove the intradermal suture, grab one of the suture ends with your forceps and cut the suture. Then, on the other end, pull, slip, and extract the suture. Thank you.